And so what we're going to cover today, we're going to cover the myths of Botox. Okay, the myths of Botox. So sometimes you hear about the myths of Maui and so forth, but we're going to talk about the myths of Botox today. So it's interesting. It seems to be a hot topic as it's been around now for 20 plus years. I can remember talking about it first way back when on KSRO Ask the Expert when it first came out. So there are still some misconceptions about Botox, and so today I'd like to maybe clear that up with you today. Okay, so let's start off with just talking about what Botox is. And so when I talk about Botox, I use it interchangeably with two forms of Botox that we use. We use the brand name Botox and also Dysport, which is another form of Botox. It's a little bit like using the word Kleenex for tissue. It might be Scott's tissue, whatever tissue it may be, but we sometimes just call it Kleenex. Same thing with Botox. So let's just talk about Botox. It came out way back at the turn of the century, and it was one of those by accident discoveries, and there are a lot of them in medicine. For instance, one that's kind of funny is that the companies were developing a blood pressure medication to help to lower high blood pressure in the lung system. It's kind of a rarer disease. It's called pulmonary hypertension. And so they were developing a drug for that in order to help to lower that pressure, and they were doing studies. And so as they did the studies, they found that unfortunately it didn't seem to give the results that they were looking for. And so when they asked for all of the samples back for the study candidates, many of the men didn't want to return them. And they then found out why, and then later released it as Viagra. So that's kind of a funny story about how they're developing a drug for one reason, and they're finding out maybe it does something better. I used to be an organ transplant surgeon, and so one of the medications that we use was originally developed to be an antibiotic. And then we found out that it was great at suppressing the immune system or the rejection system, and it was called cyclosporin. So there's another example. And the same thing happened with Botox. So there is a problem where patients were having this spasm around their eyes. Okay, and it was the doctor Alistair. It was a great couple, one ophthalmologist and one a dermatologist. And so the ophthalmologist was injecting Botox, which relaxes muscles around the eye to help to stop that spasming around the eye. And lo and behold, the dermatologist, also kind of observing this, found that the patients aesthetically looked better, that they had less wrinkles. And that's how Botox sort of came about for cosmetic reasons. One of the initial reasons, however, for Botox was to treat medical issues such as muscle spasms around the eye. And another indication for Botox were for people who had cross-eyed or what we call strabismus. And they have all these muscles around our eyeball that kind of move it all over the place. And so what they would do for people whose eyes were cross-eyed is they would figure that out physiologically, and they would inject the muscle around the eyes, certain ones, to help to bring that one that was looking cross-eyed to bring it more in alignment. And so those were the medical treatments that Botox was initially used for. But then, of course, the demand for less wrinkles, and we know that there's been a demand for that for centuries, right? That they found that Botox was wonderful for that. So Botox has been around since the 2000s. It is a protein that is created in a lab sterilely. And what it does is it helps to relax the muscles. If you're kind of a scientific nerd, what it does is it inhibits a neurotransmitter that goes from our nerves onto our muscles. So if there's a nerve that's going to the muscle causing it to contract, it actually releases a chemical, acetylcholine, onto the muscle, which causes it to contract. Well, Botox inhibits the release of that neurotransmitter or acetylcholine. That's why they're called neuromodulators. And so then it softens the contraction of the muscle. And that's the physiology of Botox itself. I mentioned Dysport, which is another form of Botox. It's a competing company, and we also use that in our office, and we use them interchangeably. And when you come in, and our consultations are always complimentary, you can come in and we can describe for you why Botox might be better for you in one area and why Dysport might be better in another area. So that's kind of the evolution of how Botox came around for cosmetic reasons. So having just described that, now what we're going to do, we're going to talk about myth number one. And so it's interesting that I got an email from one of my colleagues, Dr. Peter Schmid, who's in Colorado. I love him. He's a cosmetic surgeon and he's an artist, and he actually teaches sculpting for surgeons and does workshops. And unfortunately, I missed the last one at the American Academy of Cosmetic Surgery, but he teaches surgeons how to sculpt with clay, both the face and the body. So he has a great artistic eye. I have a lot of respect for Dr. Schmid, and he sent out a newsletter to his patients that I also receive, and it was discussing the myths of Botox. So I downloaded it, and what I thought I would do is just sort of go through those with you and give you my insight. So the first myth was Botox will freeze your face. Okay, Botox will freeze your face. I don't want to be frozen. That's what everyone says if for the first time that they have Botox. And I will tell you that I've been using Botox as a patient, having our great staff inject me for the last 20 years, and that it is not an issue. I can still frown when I want to. I can smile and have a little bit of a crinkle in my eyes, but I will absolutely tell you that because of the softening of the muscles that I don't want to be overactive, that it's helped me to have a more wide-eyed, open, happier face. And that's really the look that I would like to reflect who I think I am internally. Okay, so I think I'm that way. A little story is that I've shared in the past is that I have that I, just like you, I'm a patient, and I had Botox. And at one point I thought, do I really need to do that for my frown, or what we call the 11s between the eyes? Okay. And I thought, maybe I don't really need to do it anymore. I want to be able to show a little more concern, so forth. And so I stopped having my staff inject me with Botox. And my daughter at the time was in graduate school, was back home visiting, and I came home. It was summertime, and she said, "Dad," when I came home, "what's wrong? Are you okay?" And I said, "Erica, I'm great. I'm fine." And my wife then also said, "No, really, seriously, honey, are you okay?" And I said, "No, really, I'm okay." And then I thought to myself, I had that aha moment. Aha, I'm frowning even when I don't realize it. When I'm thinking I'm frowning, and I'm emoting or giving off an impression that I'm not as happy, or I'm concerned, or maybe I'm sad. So what did I do the next day? I went back to the office and I asked Mary, our lead nurse, please inject me with Botox in my frown area so that I don't look sad or angry or overly concerned when actually I'm happy. And that's the reason why I do Botox now for myself. I also have Botox injected around my eyes to open up my eyes more. When we inject the area, or the 11s, the frown area, just above the nose and between the eyebrows, that actually helps to open up our eyes out on the outside. And I also have my crow's feet, or what the younger generation calls smile lines, on the side of my eyes. I have that area injected with Botox to soften the muscle movement in that area, so that my eyes will also be open. Being primarily of Asian descent, and with my lids hanging lower as I age, I want to open up my eyes as much as possible. So that's why I use Botox, and just sort of a little personal vignette as to how we may not think we need it. And then when I came off of it, I realized that I was beginning to maybe again emote out more of an impression of how I felt, being sad or angry, or maybe concerned, overly concerned or focused. And it gave me a more pleasant appearance. And so, of course, that's what I wanted. So Botox doesn't necessarily freeze your face. If you go to a reputable injector, it can be a doctor, a nurse, physician assistant, nurse practitioner, you go to somebody who is reputable, who knows what they're doing, has a lot of experience, they can walk it through with you. How much relaxation of the muscles do you want? How much animation of your face do you want? And we can adjust the dosing to be appropriate for you. Most people who have Botox, you don't even know they get Botox, okay? The days of overly treating people are kind of over. Everybody wants more of a natural look now. So we do have movement where we can frown a little bit, or when we smile, we get a little bit of a crinkle in our eyes. And that's related to the more traditional standard doses of Botox or Dysport that we would normally give. It's an interesting aside that even though some people, the first time that they have Botox, they'll say, I don't want to be frozen. Okay, Dr. Tom, I don't want to have a frozen look. We treat them, we give them a nice result. And then when we have them come back for follow up, they'll say to us, not, oh, I'm not, I'm frozen. They'll say, Dr. Tom, I still see some movement over here, or I still see some movement over here. And we have to chuckle to ourselves. We're kind of smirking and chuckling to ourselves because here's the patient who said, I don't want to be frozen. And then they see a little bit of movement where they don't want it, and they'll point that out. And of course, we can always inject a little bit more Botox or Dysport in that area. So it's kind of funny that initially that most of the patients will say, I know I don't want to have that frozen look. And then in follow-up, they'll say, I see some movement over here. Do I need a little bit more? And it's just kind of a funny little tidbit that we find in cosmetic medicine and aesthetic medicine that occurs. So you absolutely do not have to have a frozen look. It is related to several factors. Number one, how many units? So that's something to discuss with your doctor or nurse, okay? Nurse injector. How many units do I need in this area? Normally, we start off with a standard amount in certain areas, okay? And I don't usually deviate much from that because this is a process, okay? The Botox or Dysport lasts 3 to 4 months. So the good thing is that if you're maybe not as happy with the results, it's going to wear off in 3 to 4 months. And unfortunately, the yin and the yang is that if you don't if you love the way that it looks, it wears off in 3 to 4 months. So Botox or Dysport is something that you have to plan on if you like the results, doing it about 3 times a year, okay? Just in terms of you figuring out your economics, how much you want to spend on aesthetic procedures, okay? So what we'll do is we'll start off with the standard amount. Now, we may find that it's perfect, and I will tell you that in about 90% of the cases, the patients love the results. Sometimes somebody will come back and say, I see a little bit more movement. What do you think we should do the next time? And usually what we recommend is that we go up a little bit in the dosing. Okay. In terms of going down on the dosing, we can do that. I do, however, warn patients, if you're saying, I'd like to use a little bit less, and if that is monetarily motivated, in other words, I don't want to spend as much, I tend to discourage the patients from that. Not that I want them to spend all their money, but because I want them to be happy. What I will tell them is, if a standard dose is the appropriate dose for you, you're not going to be happy if you say, let's inject half so I get to spend half as much. Because number one, you're not going to get the same kind of result that you loved with the traditional doses, standard doses, and it's not going to last as long. And it's not just half that, it's going to be even less than that. So what I tell the patients is, if money is an issue, I'd rather have you wait and not do any injections at all till you have enough to pay for the full dosing, and then have the appropriate dosing for you. So those would be my words of guidance. So being frozen is, I'm going to say, something of the past when either the doctors, the nurses, or the patients wanted to have that no movement look. But that's not very popular anymore. And so just talk to your injector, go to somewhere reputable. Don't let money be the primary factor in terms of where you go. Make sure that they work with you and you can get the look that you want. Okay, so that was number one myth. Botox will make me look frozen, and that's not true. Okay, so now, how about myth number two on Botox? Okay, your face will look worse if you didn't discontinue Botox injections. Your face will look worse if you discontinue Botox injections. And that is undeniably, categorically false. That is not true. What does Botox do? Botox relaxes muscles. So what it does is it improves what we call dynamic wrinkles. So those would be wrinkles of the frown or the 11s between the eyes, okay? Or the smile lines or the crinkles on the side, okay? So, or The horizontal lines of the foreheads, when we lift our eyebrows up, those are dynamic wrinkles. And so Botox softens those muscle movements. Therefore, it softens those wrinkles. Okay. So over time, will those muscles weaken a little bit? They will. So over time, just like somebody who works out, if you work out a lot, probably Jeff goes to the gym and he's pumping iron and so forth and doing big barbell curls that I probably couldn't even move with my car. So he's got big biceps, but now we don't want him to go to the gym for a month. Okay. And so what happens to those muscles? They begin to atrophy or they get a little bit smaller. And if we don't keep on letting them go, we don't let them go for the next month and the following month, 6 months and a year, those muscles are going to get weaker and weaker. So the effects of Botox on the face will improve in terms of those muscles that maybe have been overactive become less bulky. And so therefore you don't get quite that dramatic frown or those dramatic horizontal lines or the smile lines or the crow's feet lines when we smile. Okay. But what if you stop? Okay, so if you stop, what will happen is that you will begin to see those lines. You won't see them as much initially because remember, we get some atrophy of those muscles. Now, they don't go away, okay, but we get some weakening of those muscles, okay? But then now we're not giving you any more Botox or Dysport. So that's like Jeff going back to the gym now. He gets to go back to the gym and he's pumping the big barbells. And so those muscles begin to get bigger and bigger and bigger again. And then you'll frown just like you did before Botox, okay? It might not happen in 3 months. It might happen in 6 months or 9 months, but you will see that those lines will get deeper and deeper. I do have a dear friend who, unfortunately, just has probably developed as a rare thing called antibodies to Botox, where she's not as responsive to Botox anymore. And it's interesting that we tried a couple different types of Botox, and she wasn't responding. She was able to frown more than she wanted to frown. And so what we did was we had her wait, okay? And so we waited beyond 3 or 4 months when she would normally have another injection and waited another 3 or 4 months. And it's interesting that over time, initially, we didn't see much difference. Sure, she could frown a little bit, but she looked pretty good. But now that we got out to maybe where she would have gotten 2 sessions, definitely that frown that she used to have has returned. Okay. So when you say you're going to look worse if you stop the Botox, what I would say is maybe part of that's true in that now you can wrinkle or you can frown or you get the smile lines, you get the horizontal lines that you didn't like. So yeah, those return, but it's not because you stopped Botox that something else bad happened in terms of your appearance. So that is categorically not true that you will look worse after having Botox. The beauty of Botox is that it's short-term acting. And unfortunately, the bad part of Botox, if you love the effect, is that it's shorter term acting. Okay, so that's it. So that is myth number 2. So let's go on and let's talk about myth number 3. Myth number 3, and that's anyone can inject Botox. So I would say, sure, anybody can take a medication and inject it, but is that do you want anybody to do that for you? Okay, so I don't want to be self-serving since obviously I'm a physician and a cosmetic surgeon, but I will tell you that there are a lot of great nurse injectors, there are a lot of great physician assistant injectors, nurse practitioner injectors, and non-surgeon physician injectors, as well as cosmetic surgeons like myself. The key is to go somewhere where you know that they are dedicated to safe injection practices, that they are students of our industry, of our science, and that they are perpetual students in terms of always wanting to do better. If you were kind enough to have listened to our show last week, we had Bella, who was a nursing student from Gonzaga, who was visiting with us, and she works with us during summer times. And one of the comments that I made about her that I was so excited and so very proud of her is that she has just this yearning for education, and she wants to be the best. And that's where you want to go. You want to go somewhere where they feel passionate about what they do. It's not just a job, okay? That they are reading, they're watching videos, they're going to meetings, they're talking to other colleagues. They're not just working on their own, sort of an island unto themselves, okay? You want to go somewhere where you know there's an interchange of ideas and that they want to do the best that they can for you. So not so much the title behind the name that's important, it's who the person is. So make sure that they're ethical, of course, that they have experience, that they have the passion for what they do, and that they are a student. Well, even though I teach, I think one of my favorite lines from Dr. Niamtu, who's a cosmetic surgeon back in Virginia, is always the teacher, always the student, or always the student, always the teacher. And it is a perpetual cycle that you want. So can anybody inject Botox? Not really, in terms if you have a standard of results and care for the patients. Okay, so that was our myth number 3. Myth number 4 is Botox is addictive and can cause negative long-term side effects. So myth number 4: Botox is addictive and can cause negative long-term side effects. That's myth number 4. And I would disagree with that. I think if you like the cosmetic result of Botox, then absolutely, from a feeling of well-being, putting our best foot forward, from a psychological standpoint, it is something that is desirable, then sure, I guess you could say that. But in terms of a chemical dependency, okay, like alcohol or other medications, it is not addictive, okay? And long-term side effects, again, if you go to a student of the science of beauty and cosmetics, you go somewhere where you know they're practicing safe and ethical care, the side effects should be minimal. The most common side effects are maybe a little bit of a bruise, okay? Maybe not getting the result that we want. That can be that. But it's very rare to have an allergy to Botox. It's rare to develop antibodies to Botox that I had mentioned on my one friend, okay? Occasionally, if you go somewhere where they don't inject it in the right spot, you can get an untoward effect. But again, that should resolve within weeks to 3 or 4 months at the longest. So Botox is actually a very, very, very safe medication. When you hear sometimes of maybe something in the news or social media, something bad happened, it can be in larger doses where they're treating medical issues, or maybe something where an unscrupulous provider is not using the FDA approved medications that we use, and we only get them from the companies. That's why sometimes prices when you go to physician or clinics is a little bit higher, is because they are abiding by the rules of safety for you. So that's it on Botox. I hope I helped to clear up some of the myths for you. Botox is a great treatment. A lot of times it's the number one first treatment that I'll recommend for our patients. And come on in, educate yourself, learn. Our consultations are complimentary. We're happy to have you come in anytime to go over that. We actually study your face, take multiple photos. We show you where you can have it. We listen to what you want, and then we try to help to deliver on your desires with the appropriate placement of Botox or Dysport. So once again, I want to thank all of you for listening every Thursday here on Ask the Expert. I'm Dr. Walter Tom. Oh, by the way, I guess my mom would be mad at me. We are again running for Best Cosmetic Surgeon with the Press Democrat, as well as Med Spa and Esthetician. So if you could put a vote in for us, we would greatly appreciate it. And I'm going to say aloha to all of you out there today. Thank you.